If you got TMJ issues, pain in through your jaw, into the sides of your mouth, into your teeth, you're maybe getting tight muscles all the way up, in around your head, headaches, problems sleeping, sinus issues, you're noticing that you're grinding your teeth. If this is you, this video, I'm gonna teach you 6 things that you can do at home that's gonna get you relief. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. The jaw is a really complicated joint. In fact, one of the joints here at the top is a double joint. So your jaw has to go through a very specific movement, and this is why a lot of people are suffering, because it's not only from the food that we eat. It could be if you're, maybe chewed too much gum, or maybe you just recently had dental work done and then you're noticing now you're getting a lot of these pain, or anything like that. What's happening is your jaw is unstable, and when the jaw is unstable, there's a lot of muscles that are there to help it, and those muscles are getting tense, and this is why you're getting a lot of the problems. And in fact, the more that this continues, the more that you might even be damaging your teeth or damaging your bite, and then it just compounds, so it keeps going round and round. So the first thing I want you to do is we're gonna start to relieve the muscles that are governing this. And there are a few muscles in around. So this is called the temporalis. There's this muscle right in through here, and this muscle travels down to the jaw. And so when you're biting, right, if I bite my jaw, a lot of the times you'll actually see that moving. So that's the muscle that we're talking about. So what you're gonna do is on both sides, using your fingers, you're gonna put it on the side, and you're just gonna start moving this around. You're gonna start rubbing right in through here. The moment you start getting too high, you're past that point. So it's really just in the side right here. And all you're gonna do is start rubbing, and you're gonna find, just like any other muscle, you're gonna find a knot. And what you're gonna do is you're just gonna hold that knot, and you're gonna hold that. So right now I actually have one on this side. So I'm gonna hold this knot. And as I do that, I'm gonna start to actually feel that. Sometimes it'll feel like pain. It'll feel like you're releasing something. But what you're gonna do is then you're gonna start moving your jaw. So move it up and down underneath your fingers. So keep applying the pressure. I'm not going too hard, right? But you wanna apply enough pressure where you're feeling that muscle relax. And you're moving your jaw. And just do it 6 times. And after that, that muscle will be calm. The next muscle is the masseter muscle. These are the muscles on the side of the jaw. Some people actually have it quite pronounced. But what you want to do is the muscle starts at the top and it comes down, and it even goes into the sides here of the cheek. So what you want to do is you want to use your fingers again. You can use your thumbs. And what you're going to do is you're going to go downwards. So it's just a purely downwards motion. You're going right to the side. So this is called the angle right here of the jaw. So your goal here is to come right to the angle and then slightly forward at the end. Oh, that feels good. I'll tell you. I guess I do have something on the right side. I'm feeling this. So we started at the top. We moved our way down. We're into the masseter muscle. We're pushing down and forward. And just like what we did, once you find that knot, you're going to find a spot that it hurts. It does. And what you're going to do is you're going to hold into that spot. So I'll change my fingers. So I'm gonna hold into that spot. I feel right there. And then what you're gonna do is, again, 6, you're gonna open your jaw. Good. Again, and you're repeating that 6 times. That's gonna release that muscle. So right away, you're gonna start to feel a little bit better. And then what you're gonna do is we're gonna do the inside of the mouth. Now the inside of the mouth, there's these little nasty muscles. They're called the pterygoids. And the pterygoids do this movement. It's responsible for that side to side and front and back. So these are the jaw protrusion or retraction or side to side motions. And so this one's really good. Again, this is really important for massaging because it'll really help break down those tissues. So for me right now, it's been the right side. So I've been feeling this a lot on the right side. So what you're gonna do is you're gonna take your finger. So you could take your finger or your pinky, depending on whatever is easier for you. And you're gonna go like this with your finger. So you're gonna come up inside the cheek. So we're gonna go inside. We're gonna go right to the back here. You're gonna feel the bone. And what you're gonna do is then you're just gonna hold, you're gonna feel a string. It's a hard muscle, it's long, and it comes down, up. It goes this way. So what you're gonna do, I'll do it on myself. You're gonna put your finger in your mouth, you're gonna go to the back, and then just like what we did with the other massages, what you're gonna do is you're gonna keep applying the pressure. You're gonna feel this one. Now, you don't wanna bruise yourself, you don't wanna push too hard. You just wanna put enough pressure. And what you're gonna do is you're gonna hold that, you're gonna maintain that, and you're gonna open your jaw up and you're gonna close it. So open and close, open and close. So let's do that together. Do that a few times, 6 times in total, and now you're gonna release. So those are the top 3 massages that you can do to start already taking pressure off. That's gonna stop the jaw from jamming too high up, jamming the sides here at the top, so the actual TMJ joint, but also what it's gonna do is it's gonna start taking pressure off of the system, so you're not gonna get those headaches anymore. But the next ones that we're gonna do are gonna be around the control system. So there's nerves that come out of the back of your head that are really responsible for creating a lot of pressure, especially when there's a problem in the jaw. And that's because that's where those nerves go to. So there's the back of your skull, right at the base of your skull, right here. So you're gonna follow your thumbs down the back ridge here. And then right in here, these are called your suboccipitals. These are muscles that really can get sore. And what you want to do is you want to massage those. So you want to go under circles. You can also go across like this to the front. So you're bringing it down and across, but you're just staying along that ridge and you're releasing that. And as you release this, especially if you have headaches, you have a lot of problems sleeping, you have even issues where you're noticing that your neck is really hurting, including your jaw, like those are the perfect reasons to want to do that. And then to help with that area of your spine, what you want to do is you want to massage that for about 30 seconds. Don't push too hard because those muscles are very pain sensitive. So you're going to feel that quite a bit. So you just want to get in there. Again, you can go from the middle out, or you can do circles in through the base, all right? So right on the area that hurts. Typically what you'll notice, it'll be the same side. So if you're having right jaw problems, right pain, right clicking, you'll notice that it is on the same side. And then the last thing that you can do is gonna be to help your skull. So that area of your spine, this area right here, this is called the occiput. So this is how your head sits on top of your body. One of the things that we check people, so if you go to a chiropractor, if you haven't been to a chiropractor, this is a great opportunity, because if this is what you have TMJ stuff, not only can we do adjustments on the jaw to help with all that activity that you're doing, but we're also going to make sure that your alignment is there. Your head is sitting on top of your body straight, that it's not crooked to one side, or it's not forward, so you're not having this type of thing. Or the opposite could be true too. You could have gone into an accident or a fall, you had a major fall, and then you notice that you're getting a lot of these issues since then. So what we want to do is we want to balance this out. So something you could do at home is you're going to grab the back here. So this is behind the earlobe. You'll notice this is called the masseter. So you're going to grab this, and all you're going to do is bring your head completely to one side, and you're pulling on it. So you're just holding that nice and big, holding that for about 10 seconds and relieving that. And then you're going to do the same on the other side. So again, grabbing the masseter with your fingers, you're going to be pulling over. It's like you're lifting your skull up to the side and just relieving that. Only 10 seconds is all you need for that. And then the other thing you could do is take your hands, you're going to grab the back of the base of your skull. So you're just grabbing here and you're going to be pulling down. So we're really pulling down, and you know what? For me, everything was on the right side. So today I'm gonna go get my chiropractic adjustment to make sure that I am balanced. But use that information, try that. If you have questions about this video or anything else on my page, please leave a comment down below. And until next time, have a great day.